Gout is a metabolic disorder that causes a person to produce or accumulate too much uric acid crystals from the proteins they eat or to not eliminate the crystals in the urine. The crystals are deposited in joints, tendons, and surrounding tissue, causing the arthritis, symptoms of pain, redness and swelling, gouty arthritis, and causing progressive joint damage with loss of function. Although the metabolic disorder is always present, the symptoms of gout come and go. The management of inflammation and gout pain. About 10% of people who have gout can control the problem with lifestyle changes that involves eating less of the foods that produce uric acid, including shellfish, herring, sardines, salmon, haddock, and anchovies. Also, red meats, organ meats, and pork, beer and wine, and drinks that are made of high fructose corn syrup. The other 90% of patients with gout are unable to eliminate the uric acid well enough through their kidneys, losing weight if they are obese, avoiding alcohol, and including low-fat dairy products and complex carbohydrates in the diet may reduce the risk of flare-ups. When patients have symptoms of gout, general anti-inflammatory drugs can help reduce the pain of inflammation, but do not address the uric acid problem. The drugs also do not prevent progressive joint damage. Specific drugs for pain management may be prescribed during acute attacks. Drugs that lower uric acid levels can prevent gout attacks and reduce symptoms during these attacks. The most common drugs used to reduce the uric acid levels associated with gout are uric acid synthesis inhibitors. The two drugs in this class are allopurinol and febuoxstat. Allopurinol and febuoxstat help prevent gout attacks by reducing the amount of enzyme that converts purines into uric acid. As a result, there is less uric acid available to form irritating and inflammatory deposits in joints. These drugs help patients maintain a lower blood uric acid level. The main use of anti-gout drugs is to prevent gout and to shorten gout attacks. For gout prevention, they must be taken daily. Allopurinol, but not febuoxstat, is also used to lower uric acid levels that occur when rapid cell destruction, with effective cancer chemotherapy, results with a huge release of purines from inside the cancer cells. The nursing implications for gout. Take the allopurinol after a meal to prevent GI side effects. Wait at least 3 hours after taking an aluminum-based antacid. Tums, Mylanta would be an example. Before taking allopurinol because the antacid inhibits its absorption. Patients who take warfarin need more frequent monitoring of their international normalized ratio, also known as INR, because allopurinol interferes with warfarin metabolism. When giving the IV form of allopurinol, do not give it to the same port or tubing as other drugs because many drugs are incompatible with it, which means that you're not to give it into the same IV tubing as another IV infusion because not all drugs are Y compatible. And your drug book will talk about what is Y compatible and what is not. And that means about if you have a drug that is already infusing, what other drug you can Y into that drug that is already infusing. Do not give either of these drugs to a breastfeeding woman because the drugs do not or do enter breast milk and their effects on the baby are not known. Febuoxstat can be taken at any time of day regardless of meals. Teach patients to drink plenty of fluids to dilute uric acid and prevent kidney complications of the drug. Teach the patients to keep all appointments for laboratory tests to monitor for drug effectiveness and toxicities. The most common side effects of allopurinol and febuoxstat are headache, rash, minor nausea. Rare side effects include breast development in men and erectile dysfunction. There is a risk of gout flare with the start of therapy. Teach patients to report increased gout symptoms. Gout flare may be managed with NSAIDs or colchicine. The adverse reactions to allopurinol and febuoxstat are rare and occur only with very long-term use. They include kidney stone formation, liver failure, heart failure, and stroke. Rarely depression and cardiac dysrhythmia have been reported. Aluminum-based antacids inhibit absorption of allopurinol. Anti-gout drugs also interfere with the metabolism and action of warfarin. Febuoxstat interferes or interacts with many chemotherapy drugs to form other metabolic products that can damage kidneys, which is why it is not used for the hyperuricemia associated with cancer therapy. The nursing implications and patient teaching. The patients are rarely hospitalized for gout. The most important action is to teach patients how to take these drugs and to prevent and control gout. Tell the patient and family the following. Take allopurinol after a full meal. Drink 8 to 16 glasses of liquids, especially water, throughout a 24-hour period. Wait at least 3 hours to take allopurinol after using an aluminum-based antacid. Febuoxstat can be taken with or without meals as it is not affected by antacids. If you are breastfeeding, do not take these drugs. Avoid foods that are high in purines because these foods may precipitate an attack that is acute. Keep all appointments for laboratory tests of uric acid levels and for liver and kidney function tests while taking these drugs. Many drugs can trigger gouty flare-ups, and it is important to let the provider know if you have gout.